My name is Caroline Young. I'm a second-year respiratory therapy student in Crown Point, Indiana. I've been in healthcare for about 10 years now as a pharmacy technician, but I always wanted to be more hands-on with my patients' care. I decided I wanted to go back to school and did some research on different professions, and respiratory therapy really stood out to me. I think so many people take breathing for granted, and I really wanted to give that breath back to those patients who struggled to simply breathe. I've been on clinical rotations now for about 9 months in school, and I have one patient who really stands out in my mind, and I will never forget them. I was on a 4-week rotation. This patient had treatment that had to be given twice a day, and they were longer treatments, so I got to spend a lot of time in the patient's room getting to know them. I got to know their favorite football team, what church they went to, their grandchildren's names, their son's names, their mom's name. Because of the friendship and the companionship that we had grown over 4 weeks, we got to express our beliefs in so many different things. And when I reminded them that I was no longer going to be taking care of them, that I had to move on to my next rotation, they expressed to me that they were ready to go home. And they didn't mean their physical home on a street somewhere. They meant to their spiritual home. We got to have a time of peace, a time of conversation, a time to be a light in this person's life when maybe things seemed to be kind of dark. We really get to be there on patients' best days and their worst days, on their first breath and their last breath. But what a rewarding job to be there through the whole journey, to give back that breath when we can, and to comfort the people and patients when we know that they're not going to get another breath.